Hi everyone, I'm Dr. Becca Boronat. I'm a veterinarian for the National Shelter Medicine Team with Best Friends Animal Society. And today we are going to talk about feline upper respiratory tract disease in animal shelters, also known as URI, URTD. We're going to talk about it because this is one of the main challenges shelters are facing nationwide. It drains resources, it affects the quality of life of the animals, the sick ones and the healthy ones, and increases length of stay. It affects staff morale and also directly impact the life saving. These diseases are deeply connected with poor housing and poor population management. It leads to overcrowding, longer length of stays, and sanitation breaks, which are causes of stress in cats, and stress is directly linked to upper respiratory disease. All of these pictures represent stress for cats in animal shelters. Cats near dogs, just the barking of a dog is a major stress factor for cats. Not having hiding opportunities and a single kitten in a dirty cage with no enrichment. By knowing that stress is one of the main causes of URI in cats in animal shelters, it's obvious as where you need to start. The first place to minimize stress is housing. Cages must be conducive to cat health with a minimum floor space of 8 square feet. And in this image, the first thing I notice is that those are double compartmented. So you must have separation from clean area and dirty area. One side is only for eating, drinking, and sleeping, relaxing, playing. And the dirty area, it's for the litter box only. Having double compartmented cages also help to minimize the stress during cleaning. Cats can be moved to one side, the portal can be closed, and you clean the other side, and then you just switch. Also, remember that cats must be hiding spaces. They need to have scratch posts, perch opportunities to present normal behavior. Housing conditions contribute to stress, and the stress to URI, which needs treatment, and treatment takes time and increases length of stay. What adds to stress, what adds to the chances of developing URI, and then needing more treatment that makes longer length of stay. What adds to stress, and with that, more disease, more treatment, and you set a vicious cycle. It is important to recognize when it's happening and to stop it as soon as possible by minimizing stress, proper sanitation protocols, biosecurity protocols, and even stopping intake when necessary. It is mandatory to reset the cycle to have a clean slate. This study on URI in animal shelters suggests that shelters must focus all efforts to minimize length of stay by increasing adoptions, redemptions, and expanding foster homes. The results showed that the cumulative probability of a cat to develop URI by day 7 of the shelter stay was approximately 30%. By day 14, it had risen to 84%. And in this graph, it shows the probability of cats developing URI on a particular day of the shelter stay. It continuously increases as length of stay increases. Animals have their individual factors that are going to determine if they are going to get sick or not, and those are immune status and age. For pathogens, they have specific virulence, life cycle, and transmission, which are going to determine how serious a condition can be. But when I look into this chart, I can't help noticing how many items are listed in the population risk factors, such as poor housing, loud environment, poor ventilation, inadequate sanitation protocols, use, rescue, and follow its instructions, untrained staff, inadequate biosecurity, and vaccination protocols, especially at intake. Animals, they must be vaccinated at the time of intake or prior. And remember, kittens must be vaccinated with a VRCP, modified live vaccine from 3 to 4 weeks of age every 2 weeks until they are 20 weeks of age. And adults at intake and 2 weeks after that. Even when they are in foster homes, we don't know when a foster is going to need to bring them back, and they need to be ready for it. Upper respiratory tract infection in cats varies substantially across the shelters, and it can be as low as 2% and as high as 60%. And this tells us how much power we have to prevent them from happening as much as possible by minimizing these factors. The URI pathogens in animal shelters are viruses that represent 80 to 90% of the total, and herpes and caliciviruses are the well-known ones. Bacteria are chlamydia, Feles, mycoplasma, Bordetella bronchoseptica, strep zoo, strep canis, and E. coli. For all of them, incubation period is 7 or less days. Herpes and calicivirus infections happens through nasal, oral, and conjunctival routes via direct contact, droplets, and fomites. For herpes virus, it can have a latent infection that persists through the majority of recovery cats, and shedding occurs with or without clinical signs. For caliciviruses, there are variations of strains and clinical signs. Carrier state is possible, and infected cats can shed post-recovery. Mycoplasma and chlamydia require direct contact in between cats, as it cannot survive outside the host. And Bordetella is shed in oral and nasal secretions, and transmission is through direct or indirect contact. When compared to dogs, causing cough is less common, but it helps to distinguish from other pathogens. Clinical signs are variable, and the ones more commonly associated with caliciviruses are oral ulceration or limping. Herpes virus is more likely to cause keratitis or corneal ulceration. Chlamydia and mycoplasma are more commonly associated with conjunctivitis without any other clinical sign. However, remember that all of this can cause overlapping clinical signs, and it's nearly impossible to make a diagnosis based solely on clinical signs. Fomite is by far the most important way of transmission. And I know we all love to kiss kitties and to hold them close to hear them purring. However, we always need to balance our interactions with them with the potential for disease transmission. Viruses are transmitted through droplets that can travel 4 to 6 feet when a cat sneezes, so consider separating cages by more than that. Sometimes that is not possible, so creating physical barriers with towels, bed sheets, or adding kennel guards can help to prevent these droplets from reaching other animals. However, this will compromise ventilation and air quality and do more harm than good. Other important things to keep in mind are that herpes virus persists in the environment for approximately 18 hours, while calicivirus 28 days. And shedding can be for a long time, but it's dramatically reduced once clinical signs are gone. So we do not need to hold cats back. But also, remember that in your population, cats appearing healthy can be carriers, what can represent 50 or more of your animals. So we are talking about healthy looking cats. So remember to always wear gloves and change it between animals. Herpes is also reactivated by stress. And what is more stressful than a shelter environment for a cat? Always keep that in mind. And we will never eliminate this pathogen from the shelter. So preventing the disease through stress reduction is going to be the #1 strategy. For diagnosing these conditions, we do have patterns, specific clinical signs, such as limping in calicivirus kittens. But even if we are confident that those cats have calici because they are limping, we cannot rule out other reasons, such as having herpes and a leg condition. So I make sure not to label anything except URI or URTD based on clinical signs. In shelter settings, we do not know which specific pathogen is causing the problem. And should we do PCR then? Up to 50% of the cats will test positive, even healthy ones. And we can get false negative as well, if not collected within the first days of clinical signs. So in shelter settings, testing is not advised and may only be helpful in outbreak situations or in cases that are not responding to treatment. We need to keep in mind that in the shelter, we are going to treat what we see, and we will not run tests unless the results are going to change what we are doing. First, because it's a waste of resources, and also because it's very, very stressful for the cats. Now, I'm going to ask to look into this image and try to guess which one is calicivirus, and the other two, what would you guess? The first one is calicivirus. The third one, herpes virus. And the one in the middle, quad toxicity. A lot of shelters are still using quad compounds to clean cages. First, quad compounds are not efficient against the pathogens we encounter in our shelters. And second, you shouldn't be using because it can be toxic to cats. Treatment is based on clinical signs and to provide supportive care. When purulent nasal discharge is present, it means that there is a secondary bacterial infection, and doxycycline is the first line of treatment. But remember that antibiotics are not indicated in most of the cases. The cats, they need support. They need a stress-free environment. They need fear-free handling. And to get out of the shelter as soon as possible, what can be done by getting them into foster homes? Antiviral agents can be considered in the treatment and are typically well tolerated and show quicker resolution of clinical signs. Topical treatment for cats with severe ocular signs is indicated, and sometimes enucleation is required. L-lysine, it's not recommended due to the lack of supporting evidence of efficacy, even though in the past we believed it helped to prevent or treat these viruses. This little gray guy here is Wally. Our medical director fostered him when he was really sick. He needed double enucleation, and he won her heart and has never left her home. Have you ever heard about foster failure before? A couple of general rules for treatment. Do not stress more the cats, and always wear gloves and change in between animals. The goal of the treatment is reduction of pathogen load. And because of this, we can stop treatment a couple of days after clinical signs are resolved, instead of prescribing a treatment for a number of days and not monitoring those cats. And also, if they are not improving within 5 to 7 days, reassess the situation. Have kennel side observation sheets, train staff, and recognize clinical signs, and for the information to be entered on it. Treatment should be started as soon as clinical signs are noticed. One study showed that kittens entering a shelter with clinical signs of URI and receiving treatment within the first 24 hours were clear for adoption 10 days sooner than the ones receiving treatment after that. This is not only important for improving clinical signs, but also to faster outcome of the kittens, and which means freeing shelter staff, space, and resources to care better for the animals that are staying in the shelter. Treat in place as much as possible. Use signage to identify sick cats, but keep them in place. It's less stressful than moving them into a new cage or a new room. Isolation rooms should be considered for severe cases only. And remember, away from barking dogs, and cages must be set to minimize stress. And remember that catnip and Feliway are one of your best friends to minimize stress in cats. One last thing to be considered is the consistent tracking of diseases in the shelter. The more we know, the more we can do about it. Monitoring infectious diseases help us detect and create interventions. Understanding the difference between diagnosis and clinical signs empowers us to do better. Make sure to have a disease surveillance SOP to monitor and document everything that is happening. Thank you so much. And remember that all efforts to reduce stress must be pursued. This is the turning point for prevention and or for minimizing feline upper respiratory tract disease in shelters. My email is on the screen. If you have any additional questions, please reach out to me.